KXAN News at noon.
Welcome back. Keeping an eye on your health today. A problem that could lead to bigger issues down the road is varicose veins. Dr. Stephen Bunker is the medical director of the Bunker Vein and Imaging Center here in Austin. Thank you so much for being here this afternoon.
My pleasure.
Let's start with kind of the definition of varicose veins and what causes them.
Well, varicose veins are commonly referred to as the dilated veins, the big blue veins we see in our skin. And they're just sort of the hallmark of what may be going on underneath with larger veins that we can't see. So the cause is generally malfunctioning veins underneath the surface of the skin that allow the blood that should be getting out of our legs to back up and cause an increase in pressure.
Now, is this always in our legs, mostly in our legs?
You know, you can get varicosities in other parts, the upper extremities and such, but mostly because we don't walk on our hands as human beings where the gravity is always, you know, as we're moving along and standing up. It's primarily a problem of the lower extremities.
What are some of the more serious issues they can lead to if it's not treated?
Well, if not treated, what happens is the stale blood that needs those veins to be conducting the contaminants and the waste products from the skin and the muscle in our legs back to the heart. As that starts to stay static in our legs, the skin starts to get darker in color, the contaminants precipitate out into the skin, and this can lead to ulceration and more serious complications.
Now, is this a genetic issue? Is it caused by certain occupations, a combination?
All of those things. There's about 8 different reasons why what puts people at increased risk, and number one in my experience has been genetics. The second is maybe overweight, lack of exercise. Females have an increased risk factor over males, standing on your feet for prolonged periods of time, things of that nature. So.
What are some of the different treatment options out there? I think we actually have a before and after picture that we can throw up there.
Yeah, this is a young woman who presented with these bulging veins, worsening after pregnancies, and after this treatment, one of the treatments that's offered, this is non-surgical, and this is her leg afterwards. So the treatment options include the time-tested vein stripping, which was done by the surgical community for many, many years. And in the last, say, the 21st century, we've gotten new technology to catch up with this old disease, and we now treat them using catheters. Same kinds of little tubes that are used to study the coronary arteries can be used to actually close these veins inside the body that aren't working properly.
And there's a new campaign out that a lot of people are jumping on board with, the Rethink Varicose Veins. What is that? Yeah,
Rethink, www.rethinkvaricoseveins.com is a great resource for bringing to the public the facts that, first of all, these are not cosmetic issues, and most insurance companies pay for these procedures. And number two, there's maybe more than 30 million people in the U.S. suffering from this, and it's usually underdiagnosed and undertreated. So we're trying to let people know that, you know, this can be done. Your insurance company, if you have it, will pay for most of it, and that you need to get in and get checked. So.
Dr. Stephen Bunker with the Bunker Vein and Imaging Center right here in Austin. Thank you so much.
Thank you.
All right. We'll be right back.